Hi there, this is Nursing Education Videos. Today I will be going over the benzodiazepines, anxiolytic and sedative sedative-hypnotic NCLEX Nursing Questions Quiz on registerednursern.com. I will be reading the review notes and doing the quiz at the same time. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I'm reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Benzodiazepines NCLEX questions for nursing students. Benzodiazepines are medications that have anxiolytics, sedative, hypnotic, and anti-seizure properties. Benzos are medications used to help treat panic attacks, seizures, alcohol withdrawal, etc. The nurses should be aware of how these medications work, why they are ordered, nursing implications, adverse reactions, and how to teach the patient how to take the medication. This quiz is part of a pharmacology NCLEX question review series and will include various medications. This series will test your knowledge on nursing implications, side effects, patient teaching, therapeutic effects, and more. Don't forget to watch the lecture on benzodiazepines and review the notes before taking the quiz. So, question number 1. Which medication below is not considered a benzodiazepine? A. Alprazolam. B. Lorazepam. C. Clorazepate. Or D. Phenobarbital. So the question is, which medication below is not considered a benzodiazepine? So it is likely D, phenobarbital. That is a barbiturate. So we can review over the notes there. So it says in the notes how to recognize them. The middle of the generic drug name will have either ZE or ZO, and most end with PAM, so PAM, or LAM, LAM. So except for clorazepate and chlordiazepoxide. So A, B, and C are benzodiazepines, and then D is a barbiturate. So the correct answer would be D. Question number 2. Select all the statements below that are incorrect about benzodiazepines. A. Benzodiazepines are CNS stimulants. B. Benzodiazepines provide the most therapeutic and safest effects when prescribed with opioids. C. Benzodiazepines can be used to treat seizures. D. Narcan is the antidote used to reverse toxicity caused by benzodiazepines. So it says select all the statements below that are incorrect about benzodiazepines. So I think benzodiazepines are CNS depressants. So that would be incorrect, and then we'll double check the notes as well. So it says, due to their ability to depress the central nervous system, they can be used to treat a variety of disorders where there is too much CNS stimulation occurring. Benzodiazepines provide the most therapeutic and safest effects when prescribed with opioids. It says here, ETOH, opioids, and other CNS depressants should be avoided while taking this medication. That would be incorrect as well. And then C. So benzodiazepines can be used to treat seizures. That is correct. And then Narcan is the antidote used to reverse toxicity caused by benzodiazepines. That is also incorrect. The antidote is called flumazenil. So FLUMAZENIL. Question number 3. Benzodiazepines amplify the effect of what neurotransmitter? A. Serotonin. B. Gamma aminobutyric or butyric acid. C. Acetylcholine. Or D. Norepinephrine. So benzodiazepines affect the central nervous system, and it's GABA that is involved. So if we go to the notes here, now if a benzo has been administered, it's a chemical substance that is hanging out, finds a special binding site between the alpha and gamma subunit. So benzos influence the GABA A receptors. So they amplify the effect of the neurotransmitter. Okay, so just reviewing the notes over here, it says benzos amplify the effect of the neurotransmitter GABA. So gamma aminobutyric acid, and GABA is an inhibitory neurotransmitter. So it would be B. Question number 4. Benzodiazepines can be used to treat all the following conditions except A. Seizures, B. Prior to an invasive procedure, C. Anxiety, D. Alzheimer's disease, or E. Insomnia. So it is likely Alzheimer's disease, but we will refer to the notes here. So it says it is used for anxiety, alcohol withdrawal, seizures, insomnia, panic attacks, and before a procedure with moderate sedation. So the answer would be D, Alzheimer's disease. Question number 5 is A/an underscore or blank type of neurotransmitter. A. Inhibitory, B. Excitatory, or C. Modulatory. So it is it's an inhibitory, so A. So an inhibitory is where they impede and decrease the potential of an action by preventing an action, hence stopping the message from being carried out. This helps create a CNS depressant state or calming effect. Question number 6. Benzodiazepines influence blank receptors. these receptors are made up of blank subunits. It has blank alpha, blank beta, and blank gamma subunits. So it says here, the receptor is designed with 5 sections, notably called subunits. It's 2 alpha, 2 betas, and 1 gamma subunit. So it influences GABA A receptors. It would be A. GABA A receptors, and then 5 alpha, or it's 5 subunits, and then 2 alpha, 2 beta, and 1 gamma subunits. Question number 7, true or false? The GABA receptor that benzodiazepines influence has 2 binding sites for the neurotransmitter GABA, which is found between each alpha and beta subunit, and 1 binding site for benzodiazepine, which is found between the alpha and gamma subunit. Okay, so on the notes here, it says it has a total of 3 binding sites. 2 sites for GABA, the neurotransmitter, and 1 special site for benzodiazepine. It has its own site. The 2 GABA binding sites are found between each alpha and beta subunit, and the 1 benzo site is found between the alpha and gamma site. Okay, so the 2 GABA binding sites are found between each alpha and beta subunit, and 1 benzo site is found between the alpha and gamma site. So it says here the GABA receptor has 2 binding sites for the neurotransmitter GABA, which is found between each alpha and beta subunit, and then 1 binding site for benzodiazepine, which is found between the alpha and gamma subunit. So this is true. Then question number 8. Which patient below is at most risk for an injury or toxicity due to being prescribed a benzodiazepine? Most risk for injury or toxicity. A 28-year-old with history of seizures. B, a 78-year-old receiving dialysis. C, a 45-year-old who is post-op day 2 from a femoral popliteal bypass. Or D, a 36-year-old receiving treatment for gastritis. So it could be C or D. And then it could be we'll double check the notes. Injury or toxicity. So it says older adults are at risk for toxicity, dependence, and abuse. So it says benzos are not appropriate for older adults. And the oldest adult is B, a 78-year-old receiving dialysis. So that would be the patient most at risk for an injury or toxicity. I thought dialysis might reduce the risk of toxicity. But if a patient requires dialysis, they already have an impaired kidney function that could put them at risk for toxicity. Okay, question number 9. You're providing education to a patient who is prescribed to take a benzodiazepine for panic attacks. Which statements below require you to re-educate the patient about this medication? Select all that apply. A. I will monitor my consumption of alcohol and limit myself to 5 beers a day. B. Driving is not recommended while taking this medication. C. I will take this medication with oxycodone to help prevent panic attacks. D. Signs of toxicity include slow heart rate, decreased respiration, extreme drowsiness, and slurred speech. So it says ETOH, so alcohol should be avoided while taking this medication. So A, C, because oxycodone is an opioid. So select all that apply would be A and C. Question number 10. Your patient is prescribed a second dose of benzodiazepine. Before administration of the medication, you assess the patient and find that the patient is extremely confused, agitated, and their speech is slurred. The patient is reporting seeing dark figures in their room and is unable to coordinate movements. Your next nursing action is to A. Document the patient findings. Continue to monitor the patient and administer the medication as ordered. B. Administer the medication as ordered. This is an expected side effect of this medication. C. Hold the medication, notify the doctor, and document findings. Or D. Skip this dose of the medication, continue to monitor the patient, document findings, and administer the next scheduled dose as ordered. So you find that the patient is extremely confused, agitated, and their speech is slurred. The patient is reporting seeing dark figures in the room and is unable to coordinate movements. So I think you would consider why the patient is being prescribed benzodiazepine. Is it for alcohol withdrawal? Is the patient being symptomatic, having confusion, agitation, and speech is slurred due to alcohol withdrawal, seeing dark figures? So do they require another dose of benzodiazepine due to the alcohol withdrawal? So it could be A, so you document the patient findings, continue to monitor the patient. A, C, or D. And then we'll verify it over on the notes here. So overdose can happen due to inability to handle the medication, like older adults are more susceptible, or when dependence of the drug develops and abuse occurs. So an altered mental status, so very drowsy or coma, agitated, confused, unable to walk or coordinate movements, and then speech is garbled or slurred. So these would be signs of toxicity. You would hold the medication, notify the doctor, and document findings. So it would be C. Question number 11. The antidote for benzodiazepines is what medication below? A. Protamine sulfate. B. Acetylcysteine. C. Physostigmine. D. Flumazenil. Or E. Fomepizole. So it is, according to the notes here, flumazenil. D. Alright, so I'm going to input the answers and see what I get for this quiz here. Alright, so the answers has been inputted. Alright, and then it says here are your results. Your grade is A. Percentage of what you got right was 100. So that's good news. Knowing where to find the information, and then also able to remember some of the answers is a step for improvement and learning. So I hope this helps. Please feel free to share this video. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel. Thank you again for listening, and I hope you have a great day.